Where am I? What happened?
We're at the hospital. You had a close call, a myocardial infarction, Mr. Finkelstein.
Oh,
Your signs tell me that you probably had untreated angina.
knew it. Angina.
And I've hooked you up to an ECG, and you also have atrial fibrillation. Yeah, I know. Now, I don't want this to happen again, okay? So I've got some drugs for you. I've put it in the same bottle just to save room and money.
Makes sense.
It's got warfarin, an anticoagulant, so that you're not going to have any embolisms or thrombus, and it'll help with your atrial fibrillation. And diltiazem, this is an antianginal. So, here you go. You can hold on to that.
What a cocktail of life this is.
Yeah, that'll keep you going for a while. Okay?
I'm pretty bad at taking drugs, but I'll try to do my best in this scenario.
Okay, just make sure you take them when it tells you to take them, alright? Because we don't want anything bad to happen to you.
Okay.
Alright. See you later, Mr. Finkelstein.
Thank you. Take that, you Nazi scum.
Yeah!
Oh! Whoa! It's been 3 months and I haven't taken any of this. Oh, better get a glass of water.
He died from that untreated atrial fibrillation. Welcome back.
Welcome back.
All right, so what did you think about that spectacle that we just witnessed?
Welcome back, Dr. Marco.
Yes, welcome back, Dr. Dan.
Welcome.
Yeah.
That was quite the spectacle. That would have to be one of the most poorly managed lives I've ever seen in my life. I think that could have totally been prevented.
Yeah, yes, it could have if he took his drugs. Don't neglect your health.
Don't neglect it. It's for your health.
Yes.
So what happened, Dr. Marco?
Well, I'm assuming because he was taking anticoagulants due to this heart attack that he had, myocardial infarction.
Myocardial infarction.
Yeah. So there was a clot.
Mm.
And this clot, it comes from soluble plasma protein called fibrinogen, which becomes fibrin.
Mm.
So this, it clots the blood vessels and the arteries and pretty much causes ischemia.
Mm. So this is the atrial fibrillation where the blood was pooling and
Yes,
forming
the
a
blood
clot.
is pooling, yes.
Was it a
Blood
global?
flow,
Yeah.
regular heartbeat.
Was
right.
it a global ischemia then that
I'm
put him
assuming
out?
so. It looked like he died of stroke.
Mm.
Yes.
Mm.
Right. So.
Sad.
So yeah, pretty much keeping this action from occurring prevents patients who have had clots or obstructions before and are at risk of another.
Mm. So, how could it have been prevented? What could have been done?
Well, if he took his medication, if he didn't eat double-stacked burgers in the first place,
Bad idea.
and yeah, just anyway.
Foolishness. So, what about the drugs? What kind of drugs would you have given him if he was to be, in his regiment of drugs there?
Yeah.
What kind of
Well,
things?
anticoagulants, like in the video, there's 4 kinds. Vitamin K antagonists, which are warfarin.
Mm-hmm.
Factor XA and thrombin inhibitors, which are heparin and heparin derivatives,
Mm-hmm.
like low molecular heparin.
Mm.
Selective factor XA inhibitors and direct thrombin inhibitors. I am going to talk about the vitamin K antagonists here.
Okay.
So warfarin, it pretty much just inhibits the synthesis of clotting factors. So by suppressing coagulation, this has to be done by decreasing the production of vitamin K, clotting factors, and inhibiting the enzyme that is responsible for converting vitamin K into its active form.
Mm.
Right. So with this done, then the blood will be thin. It's not going to clot. It's not going to cause ischemia again.
Mm.
Right.
Deep.
So, yes, very. So I'm just going to talk about some of the side effects that you might see for any of these. I'm going to focus a little bit more on the warfarin.
Cool.
But I'll just go through it. So commonly for warfarin, you may see fever, diarrhea, rash, severe cases, hepatitis, hematuria, granulocytosis, leukopenia, and very important for all of these, hemorrhage and bleeding.
Wow.
Because of
you
that.
can't emphasize that one anymore.
Yes, I know, you can't.
So important.
So because the blood is thin, it's easy for them to bleed out from GI ulcer or even brushing their teeth, bleeding gums, petechiae, I think it's pronounced.
Petechiae.
Yes, it's kind of
French.
rolls off your tongue. Yeah, so with the heparin, factor XA and thrombin inhibitors, you may see same thing, fever, nausea, vomiting, rash, but you also may see insomnia, constipation, anemia, or edema. Yep.
It looked like our friend was far too lazy. He was sleeping too much. He could use those drugs for the side effects.
I'm assuming so, yeah. So anyway, selective factor XA inhibitors. That's okay. Very similar, fever, insomnia, nausea, vomiting, constipation, anemia, edema, and rash. Direct thrombin, pretty much the same thing. You may also see dyspepsia, back pain, bradycardia, hypo or hypertension, nervousness, anxiety, headache.
That's tough.
Yes, and of course, for all of those, hemorrhage. Gotta remember that. And bleeding.
I don't ever want to deal with that in my life.
Yeah. Pretty much, yeah.
Wow, that was extremely informative, Doctor.
I hope you learned something from me.
Doctor, I feel like I've just been through a university lecture.
Well, just happens that I'm very, very smart, and I can give you my knowledge. Yes.
Amazing.
Yeah. Very good. So,
how about a song?
Let's do this. Let's play a song. It's gonna be great. You guys want a song? Let's do this.
Anticoagulants have a role to play to keep your blood flowing by getting the thrombus away. This can be done in a number of ways, as an antagonist to vitamin K or an inhibitor to thrombin and factor X. Having trouble pooping, having a fever or a rash. Hey, don't be concerned, these are side effects they say. Hey, the most important of all, this drug could make you bleed. So nurse, look out for signs of a hemorrhage and evaluate your patient for DVT.